Hello, and welcome to today's presentation of 5 things we know and 5 things we don't know but should about infant and toddler care in New Jersey, hosted by the Infant and Toddler Policy Research Center at the National Institute for Early Education Research. Just some housekeeping items for you. We want to remind you that this webinar will be recorded and everything will be shared at a later date. We ask that you use the chat function in order to share any resources that is of interest to this webinar, as well as networking. If you have any questions for the panelists, please utilize the Q&A function found at the bottom of your screen. We invite you to join in the conversation on social media using the hashtags infant and toddler care, early childhood, and Reimagine childcare. If you have any technical questions, please feel free to use the raise hand function and I will be with you shortly. So without further ado, I would like to introduce Dr. Arturo Brito, Executive Director of the Nicholson Foundation. Arturo?
Thank you, Catherine, and welcome everyone again to the webinar, 5 things we know and 5 things we don't know, but should about infant and toddler childcare in New Jersey. This webinar is being held by the Infant and Toddler Policy Research Center at the National Institute for Early Education Research, Rutgers University, or the ITC at NIEER. I am Arturo Brito, Executive Director of the Nicholson Foundation, where we strive to improve the health and well-being of vulnerable populations in New Jersey. We do so by transforming systems. I am a community pediatrician with a population health background and focus. You may ask, why would a pediatrician and our foundation be so interested in early education care and education? If we truly care about the health and well-being of our children, and if we truly understand what has greatest impact on their health and well-being, then we need to put more resources into early childhood care and education. Educational attainment is one of the best predictors of a healthy and productive life. And early childhood is the time of life when the brain is developing at its fastest. So it makes sense that we would want to ensure that all children receive high quality education starting as early as possible in life. That's exactly why the Nicholson Foundation has funded ITC at NIEER and other initiatives like Reimagine Childcare. Co-funded with the Toro Fund, Reimagine Childcare is a public awareness campaign to increase support for accessible, affordable, high quality care for infants and toddlers in New Jersey. Led by a coalition of early childhood care organizations, including Advocates for Children of New Jersey and the New Jersey Association for the Education of Young Children, Reimagine Childcare engages policymakers in thinking boldly about how to transform the early care and education system. We are proud that ITC at NIEER, together with Reimagine Childcare, are on track to endure. I would like to now acknowledge Kay Hendon, former Senior Program Officer at the Nicholson Foundation, for her work on bringing ITC at NIEER to life. Her dedication and work on enhancing the quality and accessibility of care for infants and toddlers in New Jersey will continue in her new role as Special Advisor to the Toro Fund for Early Childhood Policy. Kay, your legacy lives on through this work. Thank you for doing that. Today marks the official launch of the Infant and Toddler Policy Research Center. During this webinar, we will explore 5 things that we know and the 5 things that many of us may not know, but should about infant and toddler childcare in New Jersey. Now, I am thrilled to introduce our diverse and expert panel that represents 4 different perspectives: research, state government, local childcare providers, and advocacy. Ms. Natasha Johnson is the Assistant Commissioner for the Division of Family Development at the New Jersey Department of Human Services. Having previously worked at the New Jersey Department of Health, I am witness to the fact that she has for decades devoted her career to ensuring that all children in the state have the best opportunity to flourish. Dr. Beverly Lin, Chief Executive Officer of Programs for Parents, promoting quality child care services and linking families with childcare providers and organizations in Newark, New Jersey, and surrounding communities. Ms. Seal Zalkin is the president and CEO of Advocates for Children of New Jersey, where research, policy, and legal analysis are used to raise awareness about children's needs. Dr. Allison Friedman-Krauss is an assistant research professor at NIEER and the director of the new Infant and Toddler Policy Research Center. And Dr. Steve Barnett is the senior co-director and founder of NIEER. He has a doctoral degree in economics, and his research is focused on costs and benefits of early care and education, including its long-term effect and equitable distribution. Steve will take questions submitted from the audience after the panel discussion and make closing remarks. And now I'll hand it over to Dr. Friedman-Krauss, who will present on the 5 things we do know about infant and toddler childcare in New Jersey. Allison?
Thank you, Arturo, and thank you to the Nicholson Foundation for generously funding our new center. And also thank you to Kay for your vision for this important work. Finally, thank you to ACNJ for your technical support today. I'm excited to officially be launching our new center. There's been a lot of work, there's a lot of work to do to support infants and toddlers in our state and beyond. And the Infant and Toddler Policy Research Center at NIEER can do this work, and we're excited to do it. I'm going to start today by discussing the 5 things we already know about infant and toddler care and education in New Jersey. I expect that some of you or many of you may already know some of these things, but you may be surprised by others. And after that, we'll have a conversation about the 5 things we don't know but should about infant and toddler care in New Jersey with our panelists that Arturo just introduced. So our first thing that we know, as Arturo already mentioned, the early childhood years, birth through age 8, are important for children's development, including the first 3 years. The brain is the only organ that's not fully developed at birth. Children's brains develop rapidly during early childhood, and early experiences, including interactions with caregivers, are particularly influential during this period. Both positive and negative interactions during the first 3 years of life can have lasting effects. When children are exposed to warm, sensitive, stimulating interactions with caregivers and positive, supportive environments, it puts them on a developmental pathway to success. On the flip side, when children are exposed to early adversity, they may be set on a more difficult pathway. Responsive interactions with adults and development of relationship with caregivers beyond just parents really help build a solid foundation for strong development. It's important to remember that while the first 3 years of life are important for children, it's a time of rapid brain development and neural connections. Development doesn't end when a child turns 3. It just really sets the pathway, sets the basis for later development. And so the second thing we know is that quality matters. Research doesn't tell us everything we want to know about what quality is for early care and education for infants and toddlers, but it does tell us some things. So on this slide, I've listed several components of quality that previous studies of early care and education have been demonstrated to be effective for infants and toddlers, particularly for disadvantaged children. Many of these will be familiar to you, but I'm just going to highlight a few of them. So first and foremost, we really need qualified child care staff with training in child development who are also well supported through things like professional development, coaching, and effective leadership, including having center directors or coaches who have early childhood experience and knowledge. The staff should also be well compensated, which we know is currently a problem. Caregivers need to be sensitive and responsive to babies and toddlers' needs. And one thing that really facilitates this is low ratios and small group sizes. And in my role, both as a developmental psychologist, but also as a parent of an infant and a toddler, parent engagement is also a really important component of quality for programs. It helps for parents and providers to establish continuity between the childcare environment and the home life. And continuity is one thing that we do know is good for little kids. It also, as a parent, gives me a peace of mind to know how my children are doing during the day. The third thing that we know, and this one might come a little bit of a surprise to some people, is that infants and toddlers in New Jersey use childcare at higher rates than infants and toddlers nationally. The majority of New Jersey's 300,000 infants and toddlers are in some type of non-parental care. And about 2/3 of all infants and toddlers in New Jersey have all parents in the workforce, thus necessitating some sort of non-parental care. A recent study funded by the Nicholson Foundation revealed that 70% of infants and toddlers in New Jersey use non-parental care. At the national level, the National Household Education Survey in 2019 showed that just 50% of infants and toddlers nationally used non-parental care. Now, both of these numbers are pre-COVID, so we do know that the pandemic has definitely decreased the use of childcare. What we don't know is if it's differentially impacted childcare use in New Jersey versus nationally, but we have more studies to come that may answer those questions. Infants and toddlers in New Jersey use both center-based and home-based care at higher rates than their national counterparts. So for example, 30% of infants and toddlers in New Jersey use center-based care compared to only 21% nationally. And 40% of infants and toddlers in New Jersey use home-based non-parental care compared to 29% of infants and toddlers nationally. So given the high percentage of parents in the workforce for New Jersey's infants and toddlers and the high use of non-parental care in the state, this really just raises the importance even more of improving access to high quality care in the state. And again, as a working parent, I really appreciate the access to high quality childcare. Fourth, and this probably comes as no surprise to anybody, high quality education and care for infants and toddlers is expensive. Some colleagues at NIEER recently used the provider cost of quality calculator to estimate what it would cost to provide high quality care to infants and toddlers in a center-based program. These estimates assume things like small group sizes, higher salaries for the childcare staff, including teachers as well as the center director to account for the center director having early childhood experience, and also provides funding for education coordinator positions. Using this calculator, we estimated that the weekly cost of high quality care for infants and toddlers is about $428 per week. This translates into over $1,800 a month or $22,000 per year, which is a big number for most people. The current weekly subsidy cost for infant programs in the state is $241 per week. Therefore, there's a gap between our estimate of high quality and what the state currently has as their childcare subsidy rate of $187. This translates into a gap between the current subsidy rates and quality, our estimated quality of $10,000 per year, which is a large chunk of change for anyone, but particularly for low-income families who are utilizing childcare subsidies. For toddlers, the gap isn't so bad, but it's still not nothing. So for toddlers, we estimated that the cost of high quality is $275 per week, which is about $1,200 a month or $14,000 a year. And the gap between the subsidy rate of $200 a week is only $74 a week, which translates into $4,000 a year. It's only 40% of the gap, the size of the gap for infant care, but it's still not nothing. It's still money that is needed in the system. And just to point out, the reimbursement rate for centers that participate in Grow New Jersey Kids, the state's quality rating and improvement system, is a bit higher than the subsidy rates on the screen. However, it still does leave a sizable gap, particularly for the infants, between what the state reimburses, even at the highest quality rating in the system, and quality. And the quality rating and improvement system only reaches a small portion of our infant and toddlers currently. Fifth and finally, not all families of infants and toddlers who are eligible for childcare subsidies actually access them. Approximately 1/3 of infants and toddlers in the state are in families who are income eligible for childcare subsidies. But in order to be eligible for a childcare subsidy, you also need to have a parent who's working or in school. So it's not just based on income. So if we assume 1/3 of income eligible infants and toddlers are not actually eligible for childcare subsidy, this leaves about 22% of infants and toddlers in the state who are eligible for a subsidy. Yet only 4% of infants and toddlers in the state do receive a childcare subsidy. So therefore, we estimate that at a maximum, 18% of infants and toddlers who are eligible for a child care subsidy actually receive one. And this may be an overestimate. But also the state has no waiting list, and we don't know why, which leads us nicely into the next part of the webinar, our conversation about the 5 things we don't know but should about infant and toddler care and education. But before we get to that, I'd like to just do a quick poll to see which of the 5 things I just covered you already knew. You can select as many as you like, just click on the ones you'd like to select on the screen and hit submit. And while you do that, just as a reminder to what Catherine said at the beginning, if you have any questions for the panelists for the end discussion, please enter it into the Q&A box and we'll do our best to get to as many as possible at the end. If you have any comments or conversation or resources you'd like to share, please put them in the chat box. And if you're a social media user, please post using the hashtags on the bottom of the slide. Okay, so we have our results and it looks like, as you know, not surprising, most people already knew that a lot of the things I talked about, particularly the importance of quality and the importance of the early childhood period, as well as the cost. It was more surprising to people, as it was to us when we got the results of our study, that the rates of use of non-parental care is higher in New Jersey than nationally. So with that, I'd like to turn things back to Arturo, who will moderate the discussion between our 4 panelists on the 5 things we know, the 5 things we don't know but should about infant and toddler childcare in New Jersey. So with that, I'm going to turn it back to Arturo.
Thanks, Allison. Thank you for your presentation. Very helpful in setting this up for the panel. So as the panelists, as we go through the discussion, I ask you all to be thinking about one critical point you would like the audience members to remember long after this webinar. And we'll ask you to complete the panel discussion with that summary of that point in 30 seconds or a minute or less, and just a tidbit that you want to share with everyone, if you will. So to get us started, I'm going to first turn to Natasha, and I do ask that all the panel members turn on their cameras. Natasha, what can New Jersey do to improve equity of access to high quality care and education for infants and toddlers in New Jersey?
So thank you, Arturo, and thank you to the Infant and Toddler Policy Research Center at NIEER for the opportunity to be part of this panel today. So I would say that in order to improve equity of access to high quality care and education, we have to first continue to stabilize the childcare community due to the impacts of the pandemic, so that we can continue to focus on quality. As we begin to stabilize, we should continue to support providers through the quality rating and improvement system that Allison mentioned briefly in her remarks, that in New Jersey we call Grow and J Kids. This is our program designed to assess childcare and early learning programs, to provide training and incentives to improve them, and then to communicate that level of quality to the public. So basically you complete the process, you're then rated, and then you receive a 3, 4, or 5-star, and then that's made public for parents and communities to know what that rating is. We should encourage providers who are not currently participating to enroll in Grow and J Kids and take advantage of the supports. So upon enrollment, the provider is assigned a quality improvement specialist at the child care resource and referral agencies. Then after the initial stages of the process, there's a warm handoff to the technical assistance specialist at one of the 4 regional technical assistance centers. They support them through the entire process. The providers are then given access to scholarships, classroom enhancement grants, coaches, implementation of curriculum in the classroom, and support putting that into practice. So in other words, we don't just give them the tools, we also help them implement those tools. We also have a network of infant toddler specialists, formerly known as First Steps, at each of our child care resource and referral agencies that support infant and toddler classrooms. They help with assessments on how providers can improve their quality as they work with infants and toddlers. Providers that serve our subsidy children, that Allison also mentioned in the 5 things we know, are also eligible to receive scholarships. They can use those scholarships to receive their Child Development Associate, their CDA, credit bearing or not, and also an associate's or a bachelor's degree. And we also offer scholarships for CDA renewal. There's also ongoing professional development offered for providers across the state in multiple languages and multiple modalities. Professional development is provided through the Child Care Resource and Referral Agencies, the Rutgers Training Institute, Rowan, and Montclair University. And some of that professional development is specifically focused on social and emotional development for infants and toddlers. We've also learned a lot from our colleagues at the Department of Education who run the state-funded preschool program. So we've taken some of those lessons learned as we are building a system for infants and toddlers. So the long-term goal is for parents to not have to look for high quality, but it exists in every provider setting. So all the things that I've just mentioned are the foundation of how we get to that long-term goal and create equity and access for families.
Thank you, Natasha. That's very illuminating in many ways, even for me, which I thought I knew a lot of things about this, but I want to see if other panel members have want to add to that before I go to the next question that speaks to child care subsidies. But I don't know if anybody else wants to add to that, or and we'll have an opportunity to come back to this later on. So Beverly, I'm going to turn to you next and tell us what you think, why you think the use of child care subsidies in New Jersey in so low, and what can be done about it?
Well, first, I want to say thank you to NIEER and Allison and you too, Arturo, for inviting me here today to share a little information about infant toddler care. Well, you know, child care is driven by parental choice, and parents, no matter what their income level, can make a decision to keep children at home, leave them with grandma or another trusted adult, or put them in some type of structured early childhood setting, whether it's a child care center or family child care home. What we're seeing more of right now, at least I am here in Essex, is that I see more grandmas with babies. Even during the pandemic, we know that parents with very young children did take their children out of childcare because of their safety or their concern for their safety. So parental choice is, I would say, the number one reason why we don't see as many children receiving or families receiving subsidies. The second issue is that families have support systems, probably not as robust as they once did many years ago. I know myself, I had my grandmother, my mother-in-law, and others in my family that took care of my children while I was working. We don't see it as much, but we do know it does exist. And then depending on the family, there may be a nanny or some other person that they've identified to care for their children. And given all of that, and we have a large range of income here in New Jersey as well. So when we look at all of the families on that spectrum, we understand that there are many options that families have. Now, there are occasions that we do run across parents who don't know that the subsidy program exists. And so each child care resource and referral agency is constantly doing outreach and sending out information to places and communities where we believe child care might be needed. The other thing is that we have a partner in our child care programs. So if a parent comes to a child care center or to a family child care provider and they cannot afford that service, they are typically referred to the CCR&R for information about the subsidy program. So I think there are many things that impact that number, that dictate what that number is. But I can definitely share with you that we are getting the information out and that parents that are eligible, for the most part, know that the subsidy program is available. And then I also like to add is that we do see an influx of parents coming to apply for child care subsidy when the child becomes 2.5 and 3 years old. So at some point they've decided that, you know, maybe childcare is this structured childcare is not what I want right now, but certainly as the child gets a little older, they're able to talk and communicate, they are beginning to see the need for that service.
Thank you, Dr. Lynn, and thank you for everything you do for the Newark and Essex County communities. in this area. I'm going to shift a little bit now and talk a little bit about affordability. And Seal, I'm going to turn to you. And I know you've been working in this area for quite some time. What can New Jersey do to improve affordability of infant toddler care and, you know, for everyone, ensuring that funding for high quality care experience is there?
So, I think that it's an issue of money. More than anything else, I think New Jersey needs to make a stronger state investment in childcare. I think our state has been very successful, and how New Jersey has used the Federal CARES Act money during the pandemic, I think has been very, very positive, has supported both families and programs during the pandemic. But there are some lessons learned in that I think we could look at to determine what the childcare system should look like. New Jersey is using the federal money to change its payment policy in terms of how it supports programs, paying on enrollment rather than attendance. It has extended tuition reimbursement to families at higher income levels, and it is supporting programs at higher reimbursement rates to address the changes in circumstances. I think those are lessons learned that apply to childcare across the board, but especially to infant care. I think part of the reason that parents are not using subsidy, back to your first question, is the availability of childcare for infants and toddlers. It is probably the most difficult childcare for parents to find. So those parents who are looking for center-based family childcare, some form of regulated childcare, have a hard time. We have childcare deserts across the state where there's little or no childcare for infants and toddlers. For programs that do provide childcare based on subsidy, it's also a question of cost. As Allison pointed out at the beginning, it is a much higher cost to provide care for infants and toddlers than for children over that age. So I think availability is a factor. And to me, it all adds up to we need a greater state investment in childcare. Childcare certainly has gotten a lot of attention over the last year. I think it has been elevated in the minds of people who have not thought about childcare in the past as not only essential for parents, but essential for the economy of the state. So this seems to be a time to look at how we can invest better.
Thanks, Seal. So I think every panelist has so far has spoken has talked about quality, because it's not just about getting the care, it's an education, it's about quality early childhood care and education. So I'm going to turn to Allison, and in your presentation, you talked a little bit about this, but how would you describe the overall quality of infant and toddler child care and education in New Jersey? And what can New Jersey do to improve that quality for all infants and toddlers throughout the state?
So I'd start off by saying I don't think we really have a good sense of what the quality is for all infant and toddler care programs in New Jersey, and really nationally for that matter. There's so many different types of childcare out there for infants and toddlers, and we don't even have good measures of that quality if we wanted to try to do an assessment of it. So this leaves us with a lot of uncertainty about the quality of the different types of care out there and how quality might vary across different regions of the state by different types of provider, as well as for children from different backgrounds. For example, we don't know if the most disadvantaged infants and toddlers are the most or the least likely to access high quality care. As I discussed before, we do know that quality matters. We have some sense of some indicators of quality, but we don't really know how all of New Jersey's childcare measures up against those indicators. We do know that center-based childcare, as well as licensed home-based programs, have to meet New Jersey's minimum childcare licensing requirements. We know early Head Start programs in the state have to meet the Head Start performance standards, but that only reaches a really small fraction of infants and toddlers, even eligible infants and toddlers in the state. And that Grow New Jersey Kids, the quality rating improvement system that Natasha talked about before, sets a higher bar for programs than the licensing requirements. But so far, there's not that many percentage-wise of the programs that reach infants and toddlers that are rated yet. And maybe that's, as we talked about, a way to move quality forward is getting more programs into that system. So these things don't tell us all we want to know about quality. And it really leaves out a big chunk of programs that serve a lot of infants and toddlers, which are the unregistered home-based programs. And we really know very little about those programs. We have a little bit of information from a study that NIEER did about a decade ago that was also funded by the Nicholson Foundation, where we did quality observations of infant and toddler childcare programs, both center-based and home-based programs in one county in New Jersey. It doesn't give a great picture of the quality of infant and toddler care. In the infant classrooms we observed, 25% of them scored in the low range and 75% scored in the medium range, with none of the programs scoring in the high range. The toddler classes fared a bit better. 26% were observed to be of high quality and only 12% were low quality. But the home-based programs were not so great. They were even lower quality than the center-based programs, and all of the infant home-based programs were observed to be low quality, and 2/3 of the toddler programs were observed to be low quality. So this just is a small snapshot of data that we have, because that's really all that NIEER has as from a research perspective. And it's old. So we know that the state and there's been policy changes both at the federal level through the reauthorization of CCDBG, as well as the state's recent increase in the child care subsidy rate that may have improved the quality of programs for infants and toddlers. We just don't have the data to know for sure. So as a researcher, I would love to see a statewide assessment of childcare quality. I understand that's a really costly endeavor and really more difficult now in the COVID times when observers can't go into the programs. But if we were able to use a standardized structure observation tool in a representative sample of infant and toddler childcare programs in the state, both center-based and home-based, it would really help us to understand how quality looks for different types of programs, as well as different regions of the state. It would provide information about equity of access to high quality infant and toddler care. And it would also provide a basis for developing quality improvement plans and policies. So this is something that I think we actually might really need a new way of measuring quality. Our current observation tools are expensive and hard to do right now, and they're not all that predictive of child outcomes. So one thing that ITC maybe could do is work on developing new measures of infant and toddler care and education quality. And it's something that researchers, us hopefully as well, could work together with practitioners and the state to do.
Thanks, Allison. And clearly, we're thrilled that you are leading this center, because obviously you have that research background and understand the details of this in the way it should be, and helping New Jersey move forward, hopefully in the future.
Arturo, can I just add
absolutely, go ahead, Seal.
Allison, you make some excellent points. I think the state has made progress, as Natasha has pointed out, through Grow NJ Kids and also through First Steps, the initiative specifically for infants and toddlers. I think one positive thing is in 2018, the state created a system of tiered reimbursement so that programs who go through Grow NJ Kids and achieve a higher quality level are compensated in their subsidy rate. And actually the state put infant toddler care on a track to have a higher rate of reimbursement in going through the quality program. I think those are important steps that need to be amplified. In terms of family child care is not eligible for that tiered reimbursement. If a family child care program participates in Grow NJ Kids, and some do, we have met many family child care providers across the state, they don't achieve that. So it's not a disincentive, but it's not a great incentive to participate and improve quality. And New Jersey has a voluntary registration system for family child care to begin with. So I think looking at family child care, how we can create those incentives to strengthen those programs, especially now. We don't know what parents are going to be looking for child care when the pandemic is over. You may have parents who would not make the same choice that they made a year ago in terms of choosing a center over a family child care home. So to me, this is an opportunity to also look at how can we strengthen that home-based system.
Thanks, Seal. And I'm going to come back to the COVID-19 pandemic and seeing how you all feel it's impacted infantile care, and you started with that right now. But before we go there, I want to come back to Beverly and talk to her or ask her about something she and I and others have talked to her about, because this is near and dear to her. It's about workforce. You know, can you say something about the workforce that's needed in terms of training, compensation, and turnover, and what kind of support does the workforce in childcare in New Jersey truly need?
So before I respond to that, I'd like to just go back to the previous question, because I know there may be people on the webinar that are not as familiar with childcare programs and how they're licensed and how quality is measured. So here in New Jersey, like many other states, childcare centers are licensed by the state. A licensed program has to meet certain minimal standards that we would consider baseline or foundational. Background checks, training requirements, staff-child ratios, health and safety requirements are all part of that licensing process. While a center may have some exceptional qualities, licensing does not consider those additional qualities in the licensing process. In order to be acknowledged as high quality, there are additional standards that a program would have to meet. And Natasha talked a little bit about that when she talked about Grow NJ Kids. So I would say that the quality of infantile care varies greatly across the state. Not only that how parents think of quality may be very different than how we as early childhood educators think of quality. And so parents may be looking for, I'm just going to use this as an example, dance classes for toddlers or something like that, that typically, or that really does not fall under quality, but is something parents might want or be interested in. In terms of the workforce and even quality, leadership is key. We can't have a high quality program or a high quality family childcare provider unless the leadership, the center director, or the person that's in charge wants to demonstrate that they want to have high quality. And they do that by either becoming accredited or by meeting the standards of Grow NJ Kids. So let me just talk about the workforce a little bit. I think New Jersey is no different than other states. In the study that Allison mentioned earlier, we identified that about 60% or a little bit more were minority women who were working in the field, Black or Latino. In addition, we recognize that their skill level were not, they didn't have CDAs or credentials. I think that has changed because the state has invested a lot of money into providing scholarships. But at that time, there were a number of practitioners and childcare employees that did not have credentials or a college education. And the other thing is too, is that we have a significant turnover in our infantile classes. And that's for a number of reasons. One, I think many people that are in the field see that there's an opportunity to earn a little bit more if you work in a preschool classroom. We absolutely recognize that working with infants and toddlers is a lot more challenging and demanding than, say, with older children who can do a lot of the things independently. We know that the compensation will vary. However, we also know that the governor implemented a $15 an hour initiative, and that we are moving towards that now. And I believe as of January, we're at $12. Someone can correct me if I'm wrong, $12 an hour. So we'll be seeing the salary and compensation increase over the next couple of years. The other thing that we know about the education workforce is that specifically in those programs that take subsidy children, they have access to resources to go back to school. And Natasha mentioned this earlier. So for those who are really very interested in improving their skill sets and actually earning credentials and going back to college, there is money available to do that. And so those are some of the supports that are available right now to the staff members that are working in the infantile care workforce.
Thanks, Beverly. So to kind of close this out, there's a lot of information here, but I would be remiss if we didn't go back to say a few more words about the COVID-19 pandemic and its impact on infantile care and education in New Jersey. And, you know, is there some permanency to its impact is a concern that many of us have. And Seal, you kind of started to say a little bit about that. I don't know if you or somebody else wants to just add a few words about that before we ask for closing comments.
I would just say, I think there are a lot of unknowns and we need to look at the data now, but also as the state begins to reopen, schools reopen, parents return to work in person, not remote. My sense is from talking to parents that there may be a stronger interest in family childcare or home-based care. I think this is really an opportunity to strengthen the system that we have. And create those incentives and structure for family childcare homes to be stronger and to offer opportunities that parents may be choosing. Natasha may have more because I think the state has made significant efforts with the CARES Act funding to support the childcare system. You know, our childcare system last March, when the governor closed the state, was on the verge of collapse. You have a system that doesn't have enough infrastructure to support itself going forward. And I think what New Jersey did has helped the childcare system survive. So Natasha, I will turn it to you.
Thanks, Seal. So I was just going to say, I absolutely agree with you about the uncertainty, right? We have a lot of providers who have not even been able to reopen since March. So we have that issue. We have providers that have reopened that are still struggling because obviously they don't have the enrollment is not what it was prior to. And that to Beverly's point before, parents are making a choice whether they want their child in a structured setting or not, especially now during the pandemic. So I think, Arturo, there is a lot of uncertainty in this.
Yeah.
And Seal is right. I mean, we've made a lot of efforts to invest the federal money that we've received in our childcare community because we know and value the importance of it and want to be able to have a structure when people can and are ready to go back to work and can and are ready to make a decision about where they want their children to be as we support parents in making that decision. So I think for us, our perspective is we're going to continue to support our providers, continue to listen to what those needs are and figure out if there's ways that we can provide additional supports. But I think there are a lot of unknowns right now.
I'd like to just add real quickly that we near the Nicholson Foundation has funded, I mentioned the survey we did before about a parent survey with about childcare use for their infants and toddlers. And we just finished a second round of that survey with another set of parents and infants and toddlers in New Jersey. So we'll have a sense once we analyze that data to see a little bit about how the pandemic has impacted how maybe childcare has rebounded a little bit in the last few months. So stay tuned.
We look forward to that. Dr. Lynn, it looks like you want to add to that?
Yes, you know, we have more parents working from home now than ever. And so what we're finding is that parents are still working, some of them, but they are keeping their babies home and they are, you put them on Zoom and you see the kids run across the room and so forth. But parents are making a decision to keep their family safe, and they're doing that by keeping children home. Of course, that impacts the ability for childcare programs to provide services. I think we've also seen a shift in children in centers versus children in family childcare. Family childcare is a smaller environment. It's a more intimate environment. So I think we're seeing some parents decide, instead of putting them in the center with 20 other children, I would prefer that they be in a home with just 4 or 5 other children. So those are the kinds of things we're seeing. Of course, we don't know what will happen. You know, it's still yet to be seen what will happen as the pandemic continues to decrease. And hopefully we'll see a shift back into our typical childcare environments.
Okay, thank you for adding that. And at this point, I'm going to ask each panelist to provide the one critical point you would like our audience to remember, for years to come after this webinar is done. So Natasha, let's just start with you. And I actually keep it brief because I want Dr. Barnett to have time to take some of the questions from the audience and also make closing remarks. So Natasha?
Sure, thanks, Arturo. So I would say that though we may have unique views and maybe even differing views on some of this, I think as a state, we are very invested in early care and education, and we feel strongly about that and are very supportive. I'll throw in just a quick plug that people should go to childcarenj.gov, simple calculator to see if you're eligible for the subsidy, as that has come up a number of times, income eligible that you could see with that calculator, and all the contact information for every child care resource and referral agencies on that website, so you can get further information about it if you think that you're eligible.
childcarenj.gov.
Yes.
Thank you. Beverly, back to you. What's the one thing you want people to remember?
Parents have power.
I love it.
If you want to have high quality programs, parents have the voice to say, this is what I'd like to see. Now, of course, when they say that, they have to be prepared to pay for it. But in any event, parents have power.
Parents have power. Thank you. Seal?
So I think we're at a moment in time to really elevate childcare. And I'm going to quote my friend Winifred Smith Jenkins, who I know is on this call. We have to treat childcare like the public good that it is. Why don't we support childcare the way we support our education system, including preschool? And look at what brought our preschool program to New Jersey. Certainly was a court order, but it was a shift in attitudes toward how we educate young children. Not just childcare to support working parents, but education. And I think we need to look at infant care in the same way and support it for the public good that it is. And, this is the first time in my experience that we've had a vice president who has shared her support and interest in childcare. Let's build on that and seize this moment in time.
All right. Childcare is a public good. Good thing to remember. And Allison, we'll close it out with you.
Sure. Just build on what Steele said. I think, using this momentum to have, the state made a lot of progress for preschool for New Jersey's 3 and 4-year-olds, and we can do that for the infants and toddlers, and ITC at NIEER can help. We hope that the launch of our center is also beginning or continuation of a partnership between us as a research group with the state, as well as with the advocacy and the practitioner group. So just a thank you for beginning that conversation today, or continuing that conversation today.
Yeah. Well, thank you. And thank you to all the panelists. Your comments, your insights, this discussion, clearly this is just beginning, but New Jersey is definitely lucky to have your expertise and your leadership and your devotion to this effort. So thank you all for participating in this. So at this point, we wanted to complete the webinar. Dr. Steve Barnett will take questions that were submitted for the audience and make some closing remarks. Steve?
Thank you, Arturo, and thank you to the panel. We're going to first put up a poll, another questionnaire for you in the audience to respond to about tell us what you think are the most important issues for infants and toddlers in New Jersey. And while I'm waiting for you to do that, I'm going to continue to thank the panelists once again, to thank the Nicholson Foundation for their support of ITC. I think we had a wonderful conversation. This is exactly the kind of rich discussion from multiple perspectives about data that ITC has developed to promote, to learn from, and to support. So I think we're off to an exciting start here. I'm eager to see what you think about the most important issues after having heard this. And then we have a set of questions that I've taken from the audience. I'll start by just taking care of the kind of housekeeping questions. Well, as we go through the big distribution of improving affordability is up there at top. I'm glad to see that. But if we start with some of the housekeeping questions, we'll make recordings available. We will share the data resources on slides. We will provide information from our new survey, and I think we'd be happy to provide contact information. But we'll check with all the panelists about that. Please check out the new ITC site at NIEER.org to get this information and see what else we've posted. I'll start with a question for Seal, and then I'll get my camera back on. Seal, one of the questions is, do you think that quality is rising on the state and federal policy agenda? You mentioned a couple of things in that regard, and then anyone else who'd like to jump in on that.
Yes, I do. I think a lot of the conversation today has focused on that and the steps New Jersey has taken to improve quality through the quality rating improvement system, through first steps, and also to support quality. I think that's very important. But I think that'll take us just so far. I do think it's going to take an investment to ensure that we have the system that we want, especially for our youngest children. And workforce is a huge issue in terms of compensating a critical workforce.
Great. Another question that came up was about the use of subsidies in New Jersey. The percentage of eligible families that receive subsidies in New Jersey is almost exactly the same as the national average. But people wanted to know if more people applied for subsidies, is more money available? Are subsidies going unused at this point? Natasha, could you provide us a little bit more about that?
Sure. So what I would encourage everyone to do is, if there are people that you know or families that you think need a subsidy or are eligible for a subsidy, that they, one, go to the website, they can use that simple calculator, and then contact their local child care resource and referral agency to go through the process. There is no waiting list. If people need a child care subsidy and apply for one, they will receive one.
Well, that's certainly great.
Eligible for one, they will receive one.
You know, the workforce, everyone knows, is a big issue, both in terms of how we develop the workforce and how we better compensate the workforce. And in current context, how do we stabilize their situation? Would anyone like to add some more ideas about that and include in there the home-based providers? For example, are there ways that we might link home-based providers and center providers to help provide a more supportive environment in some way that could take greater advantage of the resources the state makes available?
So right now, there are a number of organizations that are looking at family child care, shared services alliances, or family child care hubs. And of course, here in Essex, we are looking at using Wonder School. There's not a connection with a licensed center with that particular model, but certainly it does support the idea of improving business operations and quality of services. However, there are some models that are linking family child care to licensed centers. And in doing so, you create a hub where those family child care providers can participate in training, have access to things that a licensed center might have as well. And so I think it's something that we're looking at statewide, and we're partnering with other organizations that are working in that front.
So Steve, someone also put in the chat an interesting question, and it's an issue that we've been looking at ACNJ. Some states have been very successful in developing systems of tax credits for childcare staff, for directors, to improve quality, to support childcare. And I think we've been exploring the idea of a tax credit for childcare staff, similar to an earned income tax credit. I know there are a number of comments in the chat and also in the Q&A about the difficulty of finding staff and maintaining staff, sustaining staff. That I think is something we need to look at as a state.
And Steve, can I just quickly add, because
Oh, please.
this is some of the work that ACNJ has been doing in recent years too. I think also involving the business community and employers and how they value and see childcare for their employers, low income or not, is going to be a huge part of how we can move the system forward.
All right. Anyone else like to add on that one? Well, I think there were some questions about tiered reimbursement and the other resources that this beyond, well, Grow NJ Kids and other resources. And how do people find out about those?
So there's a number of ways that they can find out. So again, I would direct people to childcarenj.gov. So there's information on there. There's a page specifically for parents and providers, because obviously perspectives are different and information that people need is tailored to them that way. All the local childcare resource and referral agencies and our technical assistance agencies are on the website as well. So people can go to the agencies in their local communities, and there are specialists there that can walk them through the entire process.
And I'll throw out one of my own questions while I'm waiting for more. Beverly set out, I think, very clearly the way parents think about infant toddler care in the current circumstance. They're likely to have reduced, some of them have had their hours reduced, their income reduced, or even out of work. Others are working from home, and they're very scared of the knowns and the unknowns about having their children in centers. So in fact, our poll does show that center use is way down, but that family home childcare use has not declined to especially family, friend, and neighbor, not declined nearly to the same extent. In fact, may have been picking up some of the kids who are not showing up in centers. I'd like to hear if people have ideas about what can be done to, obviously getting people back to work. Again, whether they'll use childcare, parents be assured in childcare in centers in particular, despite the pandemic.
Steve, you cut out a little bit in there, so I'll try to answer what I think you were asking. And I'm going to put my parent hat on a little bit now too, because my kids are back in center-based care, because as a parent, it's just really too difficult to get anything done with a toddler running around and not understanding the boundaries of work. But I think the way that my childcare center has gone about making it just feel like a comfortable environment and making their policies really clear, how they handle things and how they keep the pod separate. And my son went from didn't even want me to wear a mask, to now he wears it and doesn't want to take it off when he gets home sometimes. So I think there's things the centers can do and have been doing. Of course, that is reflected in the price that we're paying. So, but
yeah, I think there's no question it's more expensive, and the state has responded to that. Also, that the data that we do have, although it's not everything we'd like, suggests that centers have done a good job of keeping kids safe. We're just about out of time now, so I do want to wrap up. Again, thank everyone again, beginning with the Nicholson Foundation, Arturo, our panelists, and of course, everyone who came to be part of the audience. We hope you'll join us at ITC at NIEER online in the future. Thank you.